Infection is a very common problem in newborns, mainly because the baby's immune system is immature and underdeveloped, and so babies can pick up infections very easily. This is more so in preterm babies, despite all the precautions that we take. So how can we prevent infection in a newborn? The easiest way is to prevent contact with multiple people. During the neonatal period, it is best that as few people come in contact with the baby as is possible. So the essential people who are looking after the baby should be the only ones to come in contact with them, because you never know who may be harboring an infection. In fact, that person himself or herself may not know that they are in the infective period of an infection and may unknowingly transmit the infection to the baby. So the best way is to prevent these infections. However, if you're unlucky and the baby does pick up an infection, then early treatment is absolutely necessary. Infection can be either viral or bacterial. Most viral infections are self-limiting and would go off by themselves, and the babies need only supportive care during the time that they are unwell. With bacterial infections, however, the story is quite different. They would need to be investigated and early treatment instituted to prevent complications. Infections have been conventionally divided into two groups: early onset and late onset. Early onset infections happen during the first few days of life and are in many ways linked to infections that the mother has. Late onset infections are usually infections which the baby picks up after the baby is born. As far as the early onset infections are concerned, most of them present with breathing difficulty and poor feeding. And so, usually since the baby is in hospital during this period, they are picked up by the doctors, investigations sent, and treatment with antibiotics started. Depending on the baby's condition, the baby may need breathing support, IV fluids, and other forms of support. Once the baby improves, then the support is gradually withdrawn. Late onset infection can present with breathing difficulty, but usually present with lethargy, poor feeding. 30% of these babies may have an associated infection of the brain, and so a lumbar puncture is mandatory when we are investigating for late onset infections. In the case of an early onset infection, a lumbar puncture is done only if the blood culture is positive. Babies with late onset infection usually present with poor feeding, lethargy, and may or may not have breathing difficulty. With these babies, we send the investigations which include a lumbar puncture, a blood culture, and other blood tests, and we would start the babies on antibiotics based on the prevalent culture sensitivity of that area and the hospital. Once the culture sensitivity reports come back, and depending on whether the baby has meningitis or not, the antibiotics may or may not need to be changed. Antibiotics are usually given for about 14 days in case of blood culture positive infection, and usually about 3 weeks whenever there is meningitis. Most babies, if we treat them in time, will recover completely and will have very few or no sequelae following the treatment of these infections.